Laryngomalacia. Larynx means voice box. Malacia means soft. So, if you want to know the detail about this condition, laryngomalacia, I have to start with the basic structure of the voice box. Let me do that. So, if you see this picture, I have shown three pictures. Here, you have the first one is a lateral view from outside. The middle picture is a posterior view from behind, and the right side picture is an inside view, lateral view. So here, this is the epiglottis. This is the epiglottis, the leaf-shaped epiglottis, which during breathing, the position is like this. It opens up so that the air goes in normally into the trachea. And during feeding, when you take something, this closes the larynx so that the food material flows into the food pipe. I'll show you an endoscopic picture, the drawing first. So this is the epiglottis. This one, epiglottis. This is the epiglottis. It's arch shape. And these are the array epiglottic folds. So in an infant diagnosed as laryngomalacia, what happens is that array epiglottic folds are short and it's not arch-shaped. The epiglottis is not arch-shaped. During breathing, what happens is when the child takes in breath, inspiration, since the A fold is short and the epiglottis is not arch-shaped, it is pulled inside. So it collapses during breathing. So this is the airway. So if you see in this condition, there is no airway. So whenever the child tries to take in deep breath, inspiration, the child gets airway difficulty. The cause for that is, for the normal airway patency, there should be an intact, mature neural pathway. In these children, those affected with laryngomalacia, the neural pathway is not mature. Usually, it takes its time. It usually matures by the age of 2. So, since there is immature neural pathway, it cannot maintain the airway. So, there is a supraglottic collapse above the vocal cord. The structures, it tends to collapse. So, the commonest cause of stridor in an infant, the cause is laryngomalacia. Now, coming to the complaints. So, whenever the mother tries to feed the child, especially so after first or second week, during feeding time or during crying or during upper respiratory tract infection, the child starts to cough during feeding. And not only that, it can lead to choking spells too. And there will be a particular type of sound whenever the child breathes in. It's called stridor. Inspiratory type of high-pitched fluctuating stridor can be noted. These are the usual complaints. So, when the child cries normal cry, the cry is normal, clear. Mainly during the active time, like feeding or upper respiratory tract infection, they will have inspiratory stridor. Now, to diagnose this, to start with, mainly we need laryngoscopy, flexible laryngoscopy. So this procedure will be done in a laryngoscopy room, in an endoscopy room, and it hardly takes 5 to 10 minutes. And there is no general preparation needed for this. So when you do an endoscopy, it will be seen that the epiglottis, instead of being arch-shaped, it collapses. It becomes omega shape, it collapses, and the A fold is also short. And the collapse is mainly during inspiration, when the child takes in breath. Laryngomalacia is generally classified into mild, moderate, and severe, or depending on the direction of collapse, can be anterior, posterior, or lateral. And we have one more Hollinger's classification system, which starts from 1 and up to 5. So most of the cases, say about 90 to 95% of the cases, this laryngoscopy alone will be more than enough. But some cases where, in spite of treatment, suppose the complaint keeps on increasing, we have to rule out the presence of other conditions and the severity of laryngomalacia also. In that case, we'll need bronchoscopy, pH monitoring and sleep study. Now, the moderate case or the severe case, if we just leave it alone like that without any intervention, what happens is the child can develop feeding problems and there'll be failure to thrive. If the child has got respiratory distress, it can increase and result in airway obstruction too. Now, coming to treatment. To start with, the most common one is we have to counsel the parents, saying that this condition initially will increase. The diagnosis is laryngomalacia, nothing to worry. It will become normal by the age of 2. After the age of 1 or 1.5, it starts becoming normal, and by the age of 2, it will disappear completely. Meanwhile, during this waiting period, we'll start with anti-acid reflux medication, and in case of any upper respiratory tract infection, to report immediately so that the proper treatment can be given. And as far as the feeding is concerned, since the child has got feeding problem, we'll ask them to give interrupted feed, not continuous feed. Is not able to tolerate even that interrupted feed, then you have to change to thick formula feed. And bear in mind, each time you feed the child, it should be head and position, propped up position. You have to, the mother has to sit up and the head position of the child should be proper, like how it is shown in this picture. The mother should not lie down and feed. In case of mild breathing difficulty, respiratory distress, any of these positions will be of help. The first position, the prawn position, should be little careful, because by mistake during sleep, if suppose the leg becomes straight, then they have more problem. So the better opted position will be lateral position. So when you start with, you can put the child on the shoulder till the child sleeps, then you can make him sleep in the bed in the lateral position if the child has got respiratory distress. So 90 to 95% of the patient, infant can be taken care like this. Few children, like 2 to 5%, they have got respiratory distress and it is severe, and the feeding problem is increasing and there is blue discoloration of the face too, which we call as cyanosis. In that case, we have to plan for surgery. The two important things in flexible endoscopy which you have seen is the epiglottis is collapsing and the AE fold is short along with so much of loose redundant tissue, soft tissue. So what we do is, the surgery, we used to give a cut here, incision here and here, so that epiglottis is not pulled inside and the soft tissues will be removed as much as necessary. This can be done, the surgery can be done either with the normal instruments meant for this, or with laser, or the latest technique being with a coablator. So this will take care of severe cases. To summarize, when there is a diagnosis of laryngomalacia, nothing to be worried of. The main treatment, the caring part is more than the treatment, is the caring, how you manage at home. That will be more than enough. And by the age of 1.5 to 2, it completely, the stride of breathing difficulty and the feeding problems will completely disappear. Thank you so much.